Hey everyone, welcome back to the Blueprint Nursing YouTube channel. My name's Nicole, and before working here at Blueprint, I was a labor and delivery nurse. And guess what we're talking about today? Working in labor and delivery. If you've ever been curious about this specialty, hang around. I'm going to draw from my personal experience from working in LDRPs, that's labor and delivery, recovery, and postpartum units, and high-risk OB units to give you a sneak peek into working as an L&D nurse. Labor and delivery, or L&D, is where clients receive care before, during, and after childbirth. Shifts begin and end with bedside report, but everything in between will depend on your assignment. Assignments will depend on census, the clients who are currently in the unit, and acuity. So, your day will depend on your client, their labor progression, and their needs. We monitor the client's vital signs and labor progression, monitor fetal heart rate tones, manage labor pain, and assist the provider during deliveries. We're also present in the operating room during cesarean sections. Each unit will have their own flow, but generally, L&D nurses will have assignments to care for antepartum, labor, triage, cesarean section, or recovery postpartum clients. Lots to cover, right? Of course, things can change rather quickly, so you may not keep your assignment for the entire shift. Okay, let's get a little bit more specific. A large part of the shift involves continuous fetal heart rate and contraction monitoring. We must ensure that the fetal heart rate is reassuring and know the interventions for signs of fetal distress. Vigilance and quick action are crucial in this field. In my experience, fellow nurses are always ready to help when they see fetal distress on the monitor. This includes keeping an eye out for other clients to be able to assist a fellow nurse when needed. And throughout all of this, we're the eyes and ears for the provider, updating them on the client's labor progress. We're also the advocate for our clients while balancing their wishes, provider orders, fetal well-being, knowledge, and safety. Along with providing emotional and physical support, we ensure that all parties in the labor and delivery process practice informed consent. We manage pain for our clients, whether it's assisting with epidural placement, practicing deep breathing with unmedicated labor clients, or monitoring postpartum pain from C-sections and vaginal deliveries. Our job is to make sure that their pain and management needs are met. I wish I can fit all the complexities of L&D into this video, so I'll add one last bit. We're also the recovery team. After birth, we monitor vital signs, hemodynamic balance, client-baby bonding, and so much more. In my experience, I've recovered both clients and their babies, which come with slightly different tasks. Of course, these are just some common tasks for a labor nurse, but there are certainly many more unique aspects to the job. Transferring from med-surg, I wasn't totally prepared for what I went into. There's an intensity to the job. Things can become critical in an instant. 1 minute you're helping with an epidural insertion, and the next minute you're implementing fluid resuscitation measures because the client's blood pressure dropped to 74/38. There are complex family dynamics and poor maternal-fetal outcomes as well. Of course, with the emotional and physical challenges, there are many rewards that come from being an L&D nurse. Never would I have thought that I would have the privilege to be present when a new life comes into the world. It never ceases to amaze me. We're the nurses that help educate clients who aren't sure what they're about to experience. We're their support system when no one else is there. And we're some of the first hands that hold their babies. My elevator pitch for anyone interested in L&D is that it is med-surg, ICU, OR, ED, and PACU all rolled into one. To become an L&D nurse, you need to pass the NCLEX to become a registered nurse. Then, the path can vary. Some people do externships on L&D units before graduation, work in mother-baby units until an L&D spot opens up, or, like me, transition from med-surg through a specialized cross-training program. I'd say reach out to your local birth centers to learn about their hiring process. L&D nursing requires technical skills, emotional intelligence, and critical thinking. It offers the chance to form meaningful bonds with families and utilize a wide range of nursing skills. If you're passionate about birth work and babies, this is your place. Even if you're unsure, feel free to comment or connect with a local L&D nurse to learn more. Thank you so much for joining me today and talking about labor and delivery. Feel free to ask any questions in the comments below. Look out for more videos about specialties in the future. And, in the meantime, check out Blueprint Nursing across all social media platforms or try out our live study group options. And see you next time.